Hello, friends. I'm your host, Sharath, and we are back with our wonderful series called Health and Healing with Dr. Saraswathi Kalvakota. We are back with part 2 of heart health, and we're going to embark into different subjects like guidelines, preventions, and how to prevent yourself from heart disease. So, Dr. Saraswathi Kalvakota is an internal medicine and pediatric specialist and assistant clinical professor at Wright State University, Boonshoft School of Medicine, Dayton, Ohio, USA. Dr. Saraswathi Kalvakota is also a board-certified pediatrician and internist associated with Wright State University faculty as an assistant clinical professor, Dayton, Ohio. She's also involved in teaching clinical medicine, teaching residents and students who are in training to become physicians. She has over 30 years of clinical experience in primary care and also a life member of American Association of Physicians of India origin. So, Dr. Saraswathi, welcome back to our another episode of Heart Health in Health and Healing with Saraswathi Kalvakota. So let's delve into our question. Just before I was talking to a friend this afternoon. That's why I wanted to frame this question. Tell us, what are the symptoms of a heart attack?
Thank you, Sharath, for your introduction again, and welcome you all for this rest of the second part of our heart health. And we have covered a few important points last week and last session, and then we are going to finish rest of them today. And the question today we are starting is with what are the symptoms? So we talked last week risk factors and so on, statistics and anatomy of the heart. So today let us start with the symptoms of the heart attack. Okay, I wanted to do this in detail because this is where your promptness, impromptu activity, will make a big difference to the patient or to your loved ones or to yourself or to anyone, as I said. How it starts is somebody who is having heart disease or developing heart disease. Sometimes it can come just like that, but that does not mean that heart disease developed overnight like that. It is being coming on gradually. How? It is narrowing the vessel, coronary vessels. The cholesterol is accumulating slowly and it narrows to the extent that one day it completely closes or blocks. So that's the time heart doesn't like it because it's cut off from the blood supply. So he needs to do something about it. Then you start having symptoms of lack of oxygen to the heart. What are those? You start feeling short of breath. You start either feeling your heart is working hard, like pounding heart. It has to work harder to pump same amount of blood. So that's one thing which causes chest pain and chest discomfort. And then the same chest discomfort can radiate to neck, your jaw, and your left side of the arm, your left shoulder, and entire chest wall. So these are some of the areas. Chest pain is an alarming sign. It warns you something is happening. You feel extremely anxious. You feel you are sweating, perspiring, and your skin is turning pale, and you are feeling dizzy, and then you feel like asthma as almost you are going to pass out. So what does that mean? The blood is not going to the brain because heart is weak now. I can't pump blood. I can't pump blood that much. So what is the first one affected is the brain. So brain starts feeling dizzy. Brain starts compromising its blood. So it gives alarming sign. Hey, I'm dizzy. So that indicates that it is going, the blood supply is getting compromised suddenly, all of a sudden. And then you can have nausea, you can have vomiting from that, and you feel extremely fatigued because the circulation telling that I'm not giving a lot of oxygen to the tissue organs. So you feel extremely fatigued. A generalized fatigue sets in so quickly. And as I said, the pain in the back and all that. So these are sudden symptoms. It can appear or it can come like a slow process. Like if it is like we may be having this slowly for over a week period, 3 days period, 2 days period, and suddenly it becomes very intense. So these are the signs. Most important thing is to be aware of it. Now, where do we go wrong in this? We think that it may be just a stomach upset. A lot of times when there is a chest discomfort, you feel, oh, maybe something related to what I ate. So, or they may think that, okay, I was in gym and then I may have strained, or I pulled something at work and then I have a muscle strain. So this is the most difficult area for anyone to really think that, oh, I'm having a heart problem. And whenever, my message is, whenever you feel this is happening suddenly, even if it is a stomach upset, I want you to be alert and then call 911 or have someone else talk to you, give them the request, tell them to just call 911, because it's just sweating and palpitations and skin pale. They are not just from the stomach upset. They can come. It's called vasovagal. But at the age, if you are a smoker, if you are, having already some blood pressure problem, if you are diabetic already, if you are having underlying risk factors going on, these symptoms should not be ignored. So my message is be alert to these symptoms and then get help right away.
Thank you, Dr. Saraswathi. Very important discussion we had, because a lot of people have vague ideas about what are the symptoms and what can be there are apprehensions around a heart attack.
Absolutely.
Now they know, and even now all of us know about how deadly it can become, how to actually be proactive. And one of my friend asked a question. I felt that was important to address here.
Yeah, sure.
We said, can aspirin save a life? And a lot of us vaguely know about aspirin being the savior. Sometimes you put it on your tongue, or there are few things here and there in the air which laymen recommend. Sometimes people go for self-medication as far as aspirin is concerned when they have no idea about what's going on. What is your take on aspirin?
Oh my God, it's a best question you have asked in the session. And I'm glad you asked, because I need to really elaborately discuss the role of aspirin and make you aware what are the things aspirin can do in situations like this. Okay, before I go on to that, again, I want you to take the message of these symptoms I just described. Do not take them easily. Make an attempt to take action right away. So if you can do that, 50% of the problems are solved. And in case if that is indeed a heart attack, your ability to get the right therapy in right time is achieved, and that can have an excellent outcome. So not everyone who had heart attack will die. Most of them, they get better and go, depending on how quickly they take action. So again, I'm emphasizing that you should be taking very quick action when you start having those alarming signs. They are warning signs. They're like time bomb. It's waiting to explode if you don't take me, because the heart is asking, I need help. I need something to get something for my heart. I cannot function. So listen to them very carefully and act on it. Okay, coming back to aspirin, Sharath, it's a good question. And we have a lot of studies in American Heart Association came up with a statement that aspirin is the lifesaver in these situations. So what does it mean? Aspirin is the cheapest medicine you can think of. And I urge all of you to have regular adult aspirin tablets at home, where you know where it is. And that's the first thing you can do when you start having symptoms. Okay, so aspirin, what is that in aspirin? It is an antiplatelet. That means it's a blood thinner. It helps to dissolve the clots which are happening at the heart level, at the coronary artery level where the block is happening. And good thing about that is it can start its action pretty quickly. Aspirin. So there are ways to take aspirin. You can either chew it and swallow it, or you can crush it and chew it and with water and then take it, or you can take just regular tablet aspirin. Regular adult tablet is a 325 milligrams dose. Okay. Now, if you have baby aspirins, you may have to take 2 or 3 of that. Baby aspirin is 81 milligrams. So our suggestion is you may have to take 3 on that, 2 or 3. So, but I would suggest 1 regular adult tablet, this is the recommendation from American Heart Association. So keep them, at ready, keep ready in your cabinet. Its lifespan is long. It doesn't expire too quickly. And at the earliest signs, if somebody is having this, let them take that. And again, the interesting is the studies have come up with those who have taken chewing by chewing the tablet, those who have crushed the took it, and then those who took the the regular whole tablet. And also I have to mention there is Alka-Seltzer. It has aspirin too. So sometimes, people who have this in their cabinet, Alka-Seltzer, you can take that too in case you don't have these aspirin tablets, because it does have Alka-Seltzer. So the whole idea is take 1 adult dose. Adult dose 325 milligrams. You take that right away. So they did study with the chewing aspirin and with the 3 different ways. The studies show that chewing aspirin is the quickest way to get into the system. That is 8 minutes. That's wonderful. And taking with the crushed and the whole tablet is less. It takes a lot more. It's 12 minutes is the longest. So why you want to delay it if you can just chew and swallow it? And that's the recommendation. But you can still, the situations are so hectic at the time and very critical. People may forget this and that. Just, whatever it is, you take it whichever way you can right away. If you remember, just take it. That's my recommendation. And lifesaver is aspirin. And there is no, you do not have to be afraid to take it, because that's the time you need it. one aspirin is not going to make a big difference. It's not going to really cause a GI bleed or anything else. It has its side effects, but we are talking about regular maintaining tablets, which can cause some side effects. But this is a critical situation. There is no reason to be concerned about the side effects of that, and this can save your life. And they have also statistics to show those who received aspirin at the first onset, early onset, there is a 23% less mortality. That means what? It did start, it did work to a certain extent. So patients went home, in a better condition. Patients had a less mortality. So in all these factors, say what? Aspirin is the lifesaver, and you can take it, and it doesn't require any big studies or bigger injections. Tablet, oral tablet, you are awake and you're conscious, take it.
Thank you. That cleared a lot of air about aspirin, because a lot of people have a lot of conjectures about, whether to take it, how to take it, whether to chew it or take it by mouth and take water and stuff. That was a brilliant answer, Dr. Saraswathi. It will relieve a lot of us, who have this anxiety about, whether to take aspirin or what is that time to take. And suppose a person is, he had a heart attack and he's stranded somewhere alone. What are your tips? What are the things they can do at that moment?
Yeah, and I hope that situation does not come to anyone. And but if it does, if it happens, and if you are left alone by yourself, one thing you can do is bring your breathing. Do not get panic and do not hyperventilate. Keep breathing and nice deep breaths, smooth breaths, and then that's one thing. And if you have aspirin, you should take aspirin. And those are the two things keeps going for that. You keep going, keep breathing, even though it is hard, keep breathing in and out, in and out, in and out. So that is another area which is very difficult to face, but don't lose your hope. You do that with the alertness and keep breathing until you get your.
Thank you so much.
Sure.
Throw some light on the diagnostic tests and heart disease management.
Okay. So I want to elaborate on a lot of tests, but you don't have to be remembering. Some you can remember because, I want to divide that into two parts. Okay. One is invasive tests. Other one is non-invasive tests. So in the time or in the event where the heart problems are taking place acutely, when you go to the hospital, there are certain tests done immediately, blood tests. They're called troponin levels, and then kidney function tests, liver function tests, and a lot of other parameters are taken. And troponin levels are specific for heart attacks. And that tells us if it is indeed a heart attack or losing those enzymes, and then that can cause, and then we have the diagnosis. So next things, then like chest X-ray and the cardiogram. These are non-invasive tests. And echocardiogram, we call sonogram. They are non-invasive tests. These can give you a lot of information about what's happening. You don't have to go through invasive tests right away, because doctors are not going to tell you, you have to go for this invasive test to get the diagnosis. You don't have to be concerned about that. They will only do that immediately if your life is really in danger, that it is completely blocked and there is nothing else can be done. And they have to do two procedures. Either they go through the angioplasty means they put the wire into the heart and then take the clot out and then they keep the clot open, or they go through the surgery. They have, depending on how many blocks you have. These are the two things they do. So that is up to the cardiologist. And all the first, what I described, the non-invasive tests, you should be able to undergo. There are other tests called cardiac scan and CT scan. Those also pretty much non-invasive. They don't give any big contrast. They look at this, it's called some of this small amount of nuclear material is given, and that gives a lot of information about your heart functioning too. And then there is another test called the treadmill test, which is a stress test. And what you need to do is to stand on the treadmill and then walk with certain gradations and certain speed. And I can say it is a non-invasive, but it requires your physical activity. You should be physically fit for that. If you are not, then they'll give you the thallium test or some other nuclear material to test and provoke your heart. So there are all tests there. And as I said, you don't have to be concerned that they're going to take you to the operating room right away just because you have a heart attack. There are so many other ways they can treat you. They will go through, they will advise you only if other options fail. All other options are not available to you. So I want you to know that there are invasive tests, non-invasive tests. You can get a lot of information from the non-invasive test, and invasive tests may be needed definitely in case it is emergency, that, it can happen anytime. You may go into more risky problems. Yes, they will recommend it. So when you come to that extent, when the recommendations are there, you have to put your discretion, and you have to have a consent. Give us a consent for, not us means cardiologists. They are the one who are doing this. So the consent has to be given by the patient and the family if the patient is not up to the mark. So this is where I want you to take message. There are tests available. A lot of tests can give you a lot of information. And the invasive tests can be decided right at the time by you or your loved ones.
Thank you so much. I'm going to ask the favorite question of all. Everyone wants to know, what are the prevention tips and guidelines to prevent yourself from heart disease?
Okay. Tips. We got a lot of tips here.
Thank you. Eager to listen to your advice.
Yeah. So what are the preventive guidelines? So having said, I brought all the acute critical problems to you, and you don't have to be worried, knowing all this. That doesn't mean it happens to everyone. No, it does not. And there are ways to prolong the disease presentation, because somebody who has a family history of high cholesterol, family history of heart disease, you can prolong the disease appearance, disease manifestation, but sometimes it can still manifest. So, but it will help you if you take care of your, if you follow the dietary modifications and certain other modifications you implement in your lifestyle, in everyday activities. It may delay the process, or it may prevent the larger aspect of the disease. So it may come into the lesser form. So, we always have to balance our risk factors to how much I can avoid that risk factor so that I can stay healthy. So that is where our real discretion comes in. Okay, what is that? You must have physical activity, and it is an activity keeping you going all day, not sit in the sofa or watching TV constantly. This sedentary life has a lot of factors which can promote illnesses. if you sit long time, if you don't have a physical activity, but the blood circulation has to be continuously circulating. The blood has to continuously circulate. How it circulates? Only when we move. If we don't move, it stagnates to a certain extent. So more activity, more blood going to your tissue organs, and tissue organs will love it because it's getting all the oxygen. So it can help you more on that. And your cardiac fitness also improves. So that is one where we always recommend. Stay with the activity. Again, it does not have to be very intense activity. So it comes like 25 minutes a day, maybe 30 minutes a day. That's not really a big time of your day. Half an hour you can put it, but diligently every day. Doing that can really protect and tone your heart and your rest of the muscles. So that is a recommendation. If you do intense physical activity, all that you have to do is 75 minutes a week. It's running, jogging, or these two are intense activities. So you can do that, but you don't have to do it every day. You can just do it 3 days a week and then keep it total to 75 minutes. That's enough for you. So that is the activity we are recommending. So what else? If someone is diabetic, they need to have a tight control on the blood sugars. Absolutely tight control. No excuse, because if it comes on a younger age, the longer effects take about 15 years, 10 years. And even then, you are still only 60, 65. So if you really take a lot of precautions from the beginning and you change your life or make life modifications proper way, you may never get into, or you may never face long-term problems of the diabetes, and which are number one is the heart disease. So control your blood sugar. And that is another one. Reduce your stress activity, another one. And if you are given any medications, either for diabetes or for hypertension or for something else, thyroid, take it regularly, because thyroid is not uncommon after a certain age. And everyone will get to be screened for thyroid in doctor's offices every year or every other year. And that is very important. And if that is indeed there, you must take your medication. Any medications prescribed by your doctor has to be taken very, very punctually and regularly. At the time, it also is very critical. Some of them have to be taken before food, after food, nighttime. So follow those. And some of the tablets should be taken empty stomach. If you do not take it in empty stomach, it doesn't absorb well. So those instructions have to be read properly and followed properly. So a couple of other things also need to be modified. You have to eat the diet which is rich in vegetables. I'm not saying vegetarian diet. It should be corrected as increase intake of your vegetables and fruits, and decrease the carbohydrate part and decrease the salt intake. And some of those little modifications can help you. And last but not least, if you are a smoker, make every attempt to quit smoking. So these are the preventive guidelines from the CDC as well as from the American Heart Association.
Thank you so much, Dr. Saraswathi. I mean, we're almost at the end of the show, and we're taking away a lot of wonderful tips and guidelines, and all about diagnosing yourself, whether you have heart disease or not, how to prevent the symptoms. We beautifully explained all that which is needed. My most important question I wanted to ask you is, tell us about what is basic life support and how do you administer it on a victim? I mean, how do you do it? I mean, who does basic life support? Throw light on this topic.
This is another very important take-home message. This is called basic life support. This is a BLS. It's a trained course, and this is available in most agencies like like what we call post office or libraries or the hospitals and several places where they conduct these training sessions, and it's probably $10 or $15 for the course, and it can help you a lot to feel confident and to feel confident to act at the scene. So what it does is it tells you when the patient is unconscious or the person is unconscious, how to give mouth-to-mouth breathing, how to do other way, and how to take the patient to the safest place, and how to do compressions, chest compressions, and how to ask other people to do what and what, calling for help, 911, and so many things are involved in that, and how to check the airway, whether a person is breathing or not. And if there is a defibrillator available, and the airports have defibrillators, they'll tell you how to use that. And it's the most simple technique, and it looks very scary when you see all that machine and the device there. But if you use it one time, and you will realize how safe it is. I mean, when people have they stay away from it, it's just they don't feel comfortable. They feel that they themselves are anxious about seeing that device. But I urge that the only way to take the fear is to face it. This is it applies to every situation. So if you want to really help somebody, and I even had a situation, not me, my friend, someone passed out in the airport. And it happened to be, he was a doctor, and he immediately went and got the defibrillator out, and somebody was giving chest compressions, and somebody was breathing for him, and he got this defibrillator and, shocked him. And then meanwhile, ambulance came. So it looks like, it's in minutes makes a difference. So this is a very important thing, and we will learn a lot, and you will be doing great service to your family and to your loved ones and to the community. So please find out in Google nearest places where you go for BLS course, basic life support course, and all men and women are permitted to do that, learn it, and hopefully apply when it is needed, and hopefully that may never have to come to you in your situations wherever you go. But we don't know, it can happen. And somebody swallows a big chunk of bone, and then he starts choking. What do? It's a simple thing. Those are things they teach you and not make you anxious. You don't see that anxiety. You will see how to act objectively. And that's the beautiful part. And that's the only way you can save things. You can make a difference it makes the difference between you and somebody who has not learned. So my message is, please take the course and be confident.
Thank you, Dr. Saraswathi, throwing light on so many topics, so many apprehensions we all have about heart disease. With all tips and guidelines and prevention measures, you've slowly transitioned into something very positive. You have beautifully explained about basic life support, which a lot of people have, a lot of conjectures also. We are at the end of the show, and, recently we had American Heart Health Month, and, what is your message to our Mana TV International audience as far as heart is concerned, and, a general, in a nutshell, give all our audience, how we take care of ourselves as far as heart and health is concerned.
Thank you, Sharath. And I enjoyed discussing and presenting the heart health to you all. And I'm hoping that you have a lot of points to take home. And this heart health is not anything you have to go after and worry about it. It is something you can incorporate easily in your day-to-day life. And that is the beauty of this prevention or managing yourself. So you have learned the problems, why it happened. You also learn why it is so much high in in Western countries, the incidence of the heart attacks, and how we can take care of it. All this you have learned. So the preventive was where every day matters. What is that you love most? You love most is yourself, right? And if you want to love yourself most, you have to take care of your most. And what's the most important organ in your body? Your heart. If it stops beating for 3 minutes, your body is uncontrollably goes out of harmony. So that 3 minutes is also not right for the heart. You have to be very gentle. You have to take care of your heart. Love your heart. Love yourself. Eat well. Get active. And control your blood sugar. Control your blood pressure. Control your cholesterol. And if you are overweight, try to be in moderation and seek a nutritionist. Go to a nutritionist, dietitian for a couple of times. She can make us kind of a different list of food items, what is good for you based on your habits, based on what you eat and what type of foods you eat. So she can give you a big list of things you can apply to your daily life, eating those foods. And I'm not saying you have to eat totally different diet. Eat what you are daily used to eat, but take her suggestions and incorporate it. And it will make a big difference with your heart. And last but not least, if you ever have a habit of smoking, please quit habit. Make every attempt to quit smoking. So that can take you a long way, keeping your health, heart, lungs, and entire, tissues in your body. The heart and lungs are most important organs, and you can be doing a big service to heart and lungs by quitting smoking. So these are the messages. Love your heart, do these things. Love yourself, and you have a lovely life to lead and enjoy your life. That's my message.
Thank you, Dr. Saraswathi. Thank you so much, for giving such a beautiful message. Love your heart. What a wonderful message, and I'm very sure our Mana TV international audience have enjoyed thoroughly these two special episodes on heart health. So, friends, that was Dr. Saraswathi Kalvakota in health and healing about heart health. So next week we're going to come up with another topic. Until then, please follow our Facebook page and YouTube page, and which is called Mana TV, and also follow us on live streaming YUPP TV as well. Until then, thank you so much.